Salma Saraswati is our next presenter. She's the co-founder and CEO of Tenang. She was born and raised in Indonesia, Southeast Asia. She's a clinical psychologist. She's a university lecturer, and here she is. Salma.
Yes, thank you, Lavinia. Thank you, everyone. Hold on a second. All right. All right. Okay, let me start. Yeah, hello everyone. Thank you so much for being here. I'm super excited all the way from Indonesia. It's morning here, so I hope that you're just as excited as I am today. So my name is Salma. I'm a clinical psychologist born and raised in Indonesia, Southeast Asia, and currently developing Tenang, which means peaceful or calm. In the future, it will be like Siri or Alexa for your mental health. As a psychologist myself for the last 5 years, I see that mental health is a global issue, especially in Indonesia and Southeast Asia, where more than 200 million people suffers from mental health issues, do not get effective mental health support because first, it's still stigmatized. People are afraid to talk about their mental health issues because they might get judgment. People might think that they just a lack of spirituality, or they just think that they are crazy or something like that. That's why people are afraid to go to seek for medical support. And second is that it's not available at times of crisis between 10 p.m. to 5 a.m. where mental health issues are most likely to happen. We all know that these mental health issues are something that we cannot really predict when it comes. Therefore, we need that to 24/7 support as immediate as we can. Also, in Indonesia, we don't have that 911 call for mental health. So you can imagine how frustrating and how difficult it is to seek for mental health support when the psychologists or psychiatrists are not available. Also, in Indonesia, we only have a low number of psychologists and psychiatrists available. So with that high number of people with mental health issues, it's not very available to get fast response. Therefore, our solution is to take mental health support to the next level by using technology. In this case, we are using artificial intelligence. So we are trying to develop a mobile and web application that maintains your privacy. You can anonymously talk to the application without no judgment. You don't have to worry about the judgment that you might get if you talk about your mental health problems. Also, it's available 24/7, including at 3 a.m. if you needed help. Also, it gives fast response because we use AI and in-demand session with the psychologist itself. So yes, our big vision is to be a better version of Siri and Alexa for your mental health. So you can imagine, you can just like talk to your phone saying, oh my God, I'm so stressed today. Is there anything that I can do? And the AI can easily respond with something that you needed that time. So if you ever watch the movie Her, that's something that we are trying to do in Indonesia and around Southeast Asia, hopefully in the global as well. Yes, we are a lifestyle mobile and web application to enhance teenagers and adults' well-being with the use of artificial intelligence combined with cognitive behavior therapy and behavior activation. So we're trying to digitalize the CBT itself so it can provide the response needed at certain times. We offer three things in our one mobile application. First, the AI itself. We are combining NLP, CBT, and BA, like I mentioned earlier. And our first step is still text-based, while we are actually developing the voice recognition. And the AI itself will able to develop, to provide the psychological first aid. Also, we have one-on-one counseling session with the psychologist and some self-help activities that they can do anytime. Also, we have programs to enhance the well-being of the employees. While developing our AI, we actually have got some initial traction with the counseling session after working hours. So we're trying to provide some session after working hours, and turns out For the last couple of months, we got 120 session of paid customers, and we also have got some positive feedbacks towards the session, and we are working with 74 licensed psychologists. So yeah, that's pretty good news for us at the beginning. You might then ask about what this AI actually for, and what's the benefit to the users, and what can it do, and etc. etc. So this AI will actually give 3 benefits to the customers. First is that it will give an immediate 24/7 emotional support, because we're trying to digitalize the CBT itself. That's why it might be able to give responses that sounds like talking to a psychologist. But we also have these boundaries that this AI will not provide any diagnosis, because it's not the psychologist itself, and it will not respond. It will not replace. I mean, it will not replace the psychologist in the first place. So this AI will only become like a 911, something that you can go to when the psychologists are not available at that time. And this AI will able to guide you on what to do before seeking a psychologist, and also some recommendation on what to do again to level up yourself. This is basically like the first simple steps how the AI works. The first is the customers will type in, will write their thoughts, their feelings, and etc. And the AI will able to detect the emotion that's in the message, and will generate the response based on the emotion, and the responses will be sounded appreciative, sounded like the AI understand, quote unquote, understand what the customers are feeling, and yeah, basically just give first aid kit to the customers. And this action will base on the CBT, psychoeducation, counseling, and in this case, if it's needed, we will refer to the suicide hotlines. And as for the business model, we are going freemium B2C. So we are directly to the customers, and we take 30% per subscription. And as for the market size, I said in the beginning that we are going to Indonesian market, as we see the potential and the big problem that needed to be solved here. And we will expand to some countries in Southeast Asia, because we see similar problems, similar pain points that needed to be solved as soon as possible as well. And our total addressable market value is over 200 million. So it's a pretty big market in this case. And we do have some competitors around the market in Indonesia and Southeast Asia, but we believe that we have some values that we can offer to the customers. Also, we can say that we are the first and the only mental health support using AI in Indonesia for now. As for the go-to-market, we are going to go with the mobile application and also social media with the message making 24/7 mental health support more accessible and more affordable. We are currently bootstrapping with 90 members across the globe with their own expertise. So we have this AI engineer from German who's staying in Munich, and we also have one of my co-founders is in Sydney, and also some around some cities in Indonesia. We're basically going on remote working here. And we also have some 2 amazing advisors working for us, not working, actually collaborating with us, Avnish and also Dr. Becky, who are willing to help us with the business and also the project. And yeah, last but not least, we're looking for funding $800K to actually develop this AI and reach certain number of MAU and hire key team members also for scale up and marketing. So yeah, thank you everyone for listening. I'm up for some question now. Thank you.
Thank you, Salma. Excellent presentation. Questions?
Please.
You can unmute or put in the chat. Any comments? Dr. Rahman, want to say something?
Yes, ma'am. Quick question. Salma, firstly, Assalamu alaikum, and mashallah, you've done a wonderful job. So, question, 2 questions actually is, One, what's the liability situation in terms of, once in a great while, I'm in cardiology, so I don't see, but once in a great while, patient with psychiatric issue will come into my office and say, I'm feeling suicidal. And at least over here in the US, I mean, it becomes my responsibility almost to make sure that the patient is safe. Is that a situation in Malaysia, or is there a way that you can protect yourself from this liability?
Okay, yeah. So the AI will actually, we are trying to develop the AI able to detect if the person is actually suicidal or intended to harm themselves. And also in the beginning of the app, we are actually trying to make sure that the person will not use this application if they're suicidal or they have that intention to harm themselves, and we are actually not responsible for that if they use it in that situation. And also we are always trying to refer them to other hospital or other more reliable thing if they are actually intended to harm themselves or anything like that. But so far in Indonesia itself, we don't really have that 911 call after working hours. So you can just like go to emergency, and we actually list down the emergency hospital around the area, so they can actually have access to that for now. Yep.
Very nice. And just a comment, the next thing is a comment. I think this is an awesome project. I see the value of this very much. If you were to expand beyond Indonesia, do you think you're equipped to handle like cultural differences and language differences and such?
Yeah, actually the AI will be based on the data. So as much the more data we have on the AI, it will able to detect more. So if we want to expand to other countries outside Indonesia, we will need to have a lot more data on that. So actually we can do that as long as we got more data on that. And there's a lot of adaptation that we need to do before expanding to other countries. But yes, that's actually possible to do that.
I hope you do. Good luck.
Thank you.
It's being developed in English, right? For English speakers?
For now, yes, because our target market is actually the millennials and Gen Z, and we see here that even even people millennials and Gen Z here are mostly talking in English. So I guess we started it there first.
Excellent.
Thank you.
Other questions, comments? So I would like to thank you